Temporalis. Temporalis muscle, it is starting from the temporal fossa. This temporalis muscle, it starts from the temporal fossa, and what you see, ultimately it is inserted to the mandible to the coronoid process, guys. This process here is called as a coronoid process here. I'll tell you why these things are important. Coronoid process. If you look at the muscle, the fibers are running downwards and the fibers are running forward also. You can see these fibers are running forward here. So every time temporalis muscle will contract, obviously it will pull the insertion point toward the origin point. That means these fibers which are vertically oriented here, horizontally vertically oriented here, they will pull the mandible upwards. So one action of temporalis muscle is going to be to pull the mandible upwards because of these fibers. And look at these fibers which are more or less horizontally placed, they will pull the mandible in this direction. Agreed? So simply the two function of temporalis muscle is going to be, number one is the elevation of mandible. That is the elevation of mandible. And number two is the retraction of the mandible. And this is unique here, guys. I'm putting a mark on this, on the retraction here, because that's a unique function. No other muscle of mastication can cause the retraction of mandible. That's the only muscle which can pull the mandible back, can retract the mandible back, and that is temporalis here. So temporalis muscle originating from the temporal fossa. I'm not too much bothered about the origin. I'm mainly bothered about the insertion, guys. If they give you the image based question, you have to look into the insertion part here. Where the muscle is inserted, coronoid process. Not to the head, neck of mandible, not to the ramus. It is to what? It is to the coronoid process, and the fibers are running upwards and the fibers are pulling the mandible upwards and backwards. So the two function of temporalis is going to be the elevation and retraction. Elevation and retraction. Simple? Okay. The next muscle we'll see here, guys, the muscle which is cut in this picture, that is a masseter muscle. So masseter muscle is shown in this image properly here. So this muscle that you look in this image here is the masseter muscle, right? This muscle is masseter. Let me highlight the muscle so that there is no confusion. So that's the masseter muscle here. And if you look at the fibers of the masseter muscle, they are inserted on the ramus of mandible. Every time you look at the you have to look at the muscle, you need to look at how the direction of the muscle fiber is towards the mandible. The important thing is, guys, towards the mandible, it is running in what direction here? Mandible is a point of insertion. So you have to see that it is going downward or backward, whatever. So this muscle, masseter, is, you can see it is running like downward and backward toward the mandible. So if this muscle contracts, look at the fiber, obviously this muscle will pull the mandible in this direction here. And this direction tells me what? It tells me it is this muscle is causing elevation. Obviously it is again causing elevation, but the arrow is not exactly straight. So it's not only causing elevation, it is causing elevation and a little protraction also. It is taking the mandible a little forward also. So the two action of this masseter muscle, based on this arrow, I can make out that it is the elevation, that's a main function, elevation, and it helps in the protraction also. To an extent, it helps in the protraction also. To an extent, it helps in the protraction also, but elevation is the main function. If you have to choose one between the two, definitely go with the elevation being a major function here. The strongest muscle of mastication is masseter, main function is elevation, slightly protraction also. Then after masseter comes the medial and lateral pterygoid, guys. Now these two muscles, to show these muscles, guys, first of all, the ramus of mandible is cut here. You can see a part of ramus of mandible is cut. So I can see the two muscle here. If you know masseter muscle, you know a little about the medial pterygoid also, because if you look at this muscle, the one which I'm highlighting for you, this muscle is medial pterygoid. This muscle here, guys, this muscle here is medial pterygoid. Now, why I said that you know about masseter and medial pterygoid will help you remember the common thing. Masseter was also running in this direction only, but it was outside the ramus. This muscle is inside the ramus here. So there is a ramus. So we have one muscle outside, one muscle inside, but the direction is same. And because their direction is same, so their action is going to be the same as well. Look at this arrow here again. The fibers are telling you that this is going to pull the mandible in this direction here. That's why the medial pterygoid is again having the same two actions. One, it is helping in elevation, plus it is again helping, just helping in what? Protraction. Elevation and protraction. Elevation and protraction. And whatever muscles we're talking about bilaterally, guys. When they work bilaterally, that's the action they do here. Not unilaterally, bilaterally. And then comes an important muscle. The muscle which is asked maximum time in the exam is this one, and that's lateral pterygoid muscle. That's the lateral pterygoid muscle. See, the thing about lateral pterygoid muscle is this muscle is oriented completely in a different manner. There are two bellies of lateral pterygoid, as you can make out from this picture here. We have a superior belly here, the one which I'm highlighting here, that's a superior belly of lateral pterygoid, or you can say upper head of lateral pterygoid. And then there is a lower head also is there. Look at that. So there are two heads of lateral pterygoid, the upper head and the lower head. Because the muscle is directed backwards and going to the neck of mandible, this muscle is going backward toward the neck of mandible and inserted on the fossa on the mandible called as a pterygoid fovea. There is a depression on the neck of mandible. That depression on the neck of mandible where this muscle is inserted is called as pterygoid fovea, guys. That is called as pterygoid fovea. Fovea means small fossa only. Pterygoid fovea. So because the muscle is oriented backwards, so when the muscle contracts, obviously it will pull the mandible forward, because this we have to move toward the origin. Insertion will be pulled. So that's the insertion point here. So this muscle is coming backwards, so it will pull the mandible forward. So this upper belly here or upper head, it pulls the mandible in front, and the lower belly pulls in front and slightly below also. That's the only time when you see the arrow is shown a little downward here. And that's why the lateral pterygoid, two action, guys. One of the action will be what? Again, protraction. This arrow tells you protraction here, and this arrow tells you depression. It depresses the mandible, it opens the jaw. So protraction, the main muscle for protraction, that's the main muscle for protraction, and it is the only muscle for depression of the mandible or opening of mouth. That's the lateral pterygoid muscle, and both these actions are quite I would say unique in a way, because depression is done only by lateral pterygoid. When we talk about the muscles of mastication, there is no other muscle of mastication which can depress the mandible. Other muscle can help it, but temporalis, masseter, medial pterygoid, all these muscles, they help in the elevation. Only lateral pterygoid helps in the depression here. So this action, I would say, is unique. And protraction is the main action, or it's the main muscle for protraction. We saw protraction is done by what? By the medial pterygoid also. Protraction is done by the lateral pterygoid, that masseter also. But the main muscle for protraction is going to be the lateral pterygoid here. So if the question is asked, if you give you a picture and of the lateral pterygoid muscle, in whatever section they will give it to you. First of all, how to identify it, guys? Even if it is a coronal section, think of a muscle coming toward the head and the neck of mandible. Medial pterygoid, think of a muscle coming toward the medial side of ramus of mandible. Masseter, think of a muscle coming to the outer surface, lateral surface of ramus of mandible, and temporalis muscle was coming to the coronoid process and to the anterior border. If I just take you back here for 1 second, look at this muscle. Temporalis muscle is going to the coronoid process, and some fiber goes to the anterior border of ramus of mandible. Keep these insertion points in your mind, and you will not have a difficulty in identifying these muscles. Once you know the muscles, you definitely should know about their action here. So these arrows will help you remember what is the direction of the muscle fiber here. There is one more unique thing about the medial pterygoid muscle, guys. I will tell you that medial pterygoid is the only muscle of mastication. Is the only muscle of mastication which is supplied by. It is supplied by the trunk of mandibular nerve. It is supplied by the trunk of mandibular nerve, because the remaining muscles of mastication were supplied by the anterior division of mandibular nerve. Remaining all muscles by anterior division of mandibular nerve, is by the anterior division of mandibular nerve, and that also is a question which was asked in the previous year exam here. So remaining muscles is by anterior division of mandibular nerve. Only medial pterygoid is a muscle which is supplied by the main trunk. Trunk divides into anterior posterior division. So trunk supplies the medial pterygoid, remaining muscle of mastication are all by the anterior division. So this is, guys, little about the muscle of mastication and their action. Identifying them on the picture and then knowing about their action and about their innervation is extremely important. As I told you that in the entire head and neck, this is the topic which I believe that is maximum asked, and the possibility of getting a question from this part is definitely maximum.